Dr. Bear, can someone who has neuropathy improve their blood flow? And if so, what are some ways to do that?
Absolutely. So some of the classic signs that you see when someone has lack of blood flow would be would be cramping in their calves when they walk or when they sleep, or cramping in the feet when they walk or sleep. That's the classic. Sometimes a lot of night pain when you're sleeping. They have these tremendous amounts of agonizing pain in their feet or legs, sometimes even in the thighs. That's a sign to say, that's a symptom to say, hey, we've got to check and make sure that the blood flow is okay. If the blood flow is not adequate, and in order to determine that, there's a clinical exam. So you look at whether the skin looks normal with regards to, is it thin, is it shiny, does it look good in quality, and if you can feel the pulses. If you can't find those things, if there's a foot type that looks like it may not be getting enough blood flow, there's some vascular studies that we do here in the office that really thoroughly assesses whether someone has a peripheral vascular disease, PVD problem, or whether they're completely normal with that.
And is there any discolorations, like purple or anything, that comes along with poor
Sometimes,
circulation?
absolutely. Just because you have a purple foot doesn't mean that it's from PVD. Sometimes bad veins can cause that, and other conditions that can cause purplish discoloration. But absolutely, it can be. It can be a sign that makes you concerned. Hey, is there a circulation problem?
Okay.
And the greatest thing is that these tests that we offer here in the office, they don't hurt. There's not dye being shot into any vessels or anything like that. It's a non-invasive test that's called an ankle brachial index, an ABI, and we also do what's called a PVR, and it actually looks at the waveforms of the arteries, and we listen to the tone of the artery. Gives an idea of how much blood flow is actually getting to the area.
Okay.